You're alone at home. Out of nowhere, a pressure begins in your chest. Not sharp, heavy, as if someone is squeezing your heart with both hands. Your breathing shortens, a cold sweat forms on your forehead, and a terrifying thought crosses your mind. Am I having a heart attack? In that moment, you don't have minutes, you have seconds. And the question that can determine whether you survive or not is very simple. Do you know what to do? Because most people don't, and that's exactly why so many individuals collapse alone, without ever getting the chance to call for help. Today I'm going to show you 3 emergency techniques, studied and discussed in cardiology, that may help you gain critical time while waiting for assistance. These are simple actions, things that someone over 60 can apply, even alone, even in pain, even in fear. But before I explain them, I want to tell you a story that changed the way I think about prevention. My name is Dr. Jason Watanabe, cardiac surgeon. I've treated hundreds of patients, and here on this channel, I focus on explaining health in a way that is clear, direct, and truly useful. If you haven't subscribed yet, this is the kind of information that can make a real difference, sometimes even save a life. Now, let me take you back to a moment that stayed with me. A family member of mine was in his early 70s when it happened. It was an ordinary afternoon. He was sitting outside, relaxing, enjoying the quiet. Nothing unusual. Until suddenly, it was. It started as a mild discomfort in the chest, something easy to dismiss. A sensation you might think will pass in a few minutes. But this time, it didn't. The pressure grew heavier. His left arm began to ache. He felt slightly dizzy. And he was completely alone. The phone was nearby, but not close enough. And in that moment, even a short distance felt impossibly far. He later told me that what he felt wasn't just discomfort. It was fear. A different kind of fear. Not of pain, but of disappearing, without anyone knowing. And what helped him in that moment was something simple. Something we had talked about before. A technique he almost forgot. I'll show you exactly what that was in a moment. But first, you need to understand what's actually happening inside your body during a heart attack. Because once you understand the mechanism, you'll understand why every second matters. A heart attack begins when one of the arteries that supplies your heart with oxygen-rich blood becomes blocked. In most cases, that blockage is caused by a blood clot forming on top of a buildup of fatty plaque inside the artery wall. Something that develops silently over many years. When that artery becomes blocked, blood flow stops. And the moment that happens, heart muscle cells begin to die. Now pay close attention to this part, because it's critical. Unlike many other cells in your body, heart cells do not regenerate. When they die, they are gone. They are replaced by scar tissue. Tissue that cannot contract, cannot pump, cannot support the heart's function. And the longer your heart is without oxygen, the more of those cells are permanently lost. This is why time matters so much. According to cardiology data, hundreds of thousands of people lose their lives to heart-related conditions every year, and a significant number of those deaths happen in the early phase, while the person is still at home, still conscious, still with a chance to act. Recent studies show that taking the right action within the first few minutes can dramatically increase the chances of survival. That's not a small difference. That's the difference between recovery and something far more serious. And that decision, what you do in those first moments, often depends on what you already know. But before I walk you through the steps you can take, there's something even more important. You need to recognize the warning signs, because knowing what to do only helps if you know when to do it. The most common symptoms include a pressure or discomfort in the chest, often described as tightness, heaviness, or burning that doesn't go away. Pain spreading to the left arm, jaw, or back. Cold sweating, especially on the forehead. Nausea, sometimes with the urge to vomit. Dizziness or a feeling of faintness. Shortness of breath without any clear reason. But there's something many people don't realize. In women over 60, these symptoms can appear differently. Instead of the classic chest pain, they may experience unusual fatigue, discomfort in the upper abdomen, or a general sense that something isn't right. Because of that, many delay seeking help, thinking it's just indigestion or tiredness, and that delay can be dangerous. So here's the rule. If you experience 2 or more of these symptoms at the same time, act immediately. Call emergency services right away. Do not wait for it to pass. Do not wait for someone else to arrive. Make the call first. But here's the reality. Depending on where you are, help may take several minutes to arrive, and those minutes matter. That's where the 3 techniques I'm about to show you come in, and I need to be completely honest with you. These actions do not replace medical care. They do not reverse the blockage. They do not cure a heart attack. But they may help you maintain function, long enough for help to reach you. What these techniques do is buy you time. They help maintain circulation for a few more critical minutes. They help keep you conscious. They give you a chance to receive help before the damage becomes irreversible. Every extra minute your heart and brain receive blood flow can change the outcome. Now let's go to technique number 1. This is exactly what my uncle used that afternoon. Controlled, forceful coughing. When the symptoms began and he realized something was wrong, something different from anything he had ever felt, he remembered a small detail from a conversation we had months earlier. At first, he didn't believe it would help. A cough? How could that make a difference? But he tried, and that decision mattered. Here's what's happening behind the scenes. When you cough forcefully, you create a sudden increase in pressure inside your chest. That pressure compresses the heart slightly, helping push blood forward toward the brain and vital organs. In certain situations, especially when abnormal rhythms are involved, this can help maintain circulation for a short period. Think of it as a temporary mechanical assist, a small push when your system is struggling. Now, how do you do it correctly? First, take a deep breath. Fill your lungs completely. Then close your mouth and cough forcefully from the chest. Not a light cough, a strong, deliberate one. Repeat this cycle every couple of seconds, continuously. It may sound too simple, but that's exactly why it matters. No equipment, no assistance, just action. Now, there's an important detail. This only works if you are still conscious and able to breathe. If your breathing is severely compromised or you feel like you're about to lose consciousness, you need to move immediately to the next step. Also, there are common mistakes people make when trying this. Coughing too weakly, not taking a full breath before each attempt, stopping too soon because of discomfort. The key is consistency. Even if it feels uncomfortable, keep the rhythm going. Because in that moment, discomfort is not the priority. Time is. And here's something I always tell my patients. Practice it. Not in panic, but in a calm moment. Take a deep breath. Cough with intention. Because in an emergency, your body will do what it has practiced. Practice it. Take a deep breath and cough forcefully 5 times, slowly and deliberately. It may feel unnecessary when you're healthy, but what you're really doing is training your body. Because in an emergency, when adrenaline rises and panic takes over, your body doesn't rely on logic. It relies on memory, movement memory. When you repeat an action consistently, your brain creates a faster pathway to execute it. And in a critical moment, that pathway can make the difference between hesitation and action. Now, before we move on, I want to ask you something. Had you ever heard about this coughing technique before? Let me know in the comments. I read them, and it helps me understand what information is actually reaching people. Now let's move to technique number 2. This one is less known outside medical settings. It's called the precordial thump. Emergency physicians are familiar with it, but most people have never heard of it. And that's unfortunate, because in very specific situations, during the earliest moments of a cardiac event, it can have an effect. To understand why, you need to think of your heart as an electrical system. Each heartbeat is triggered by an electrical impulse that travels through a precise pathway inside the heart muscle. When that signal is working properly, your heart contracts in a coordinated rhythm, You don't even notice it. But when that system becomes unstable, everything changes. During a heart attack, the electrical activity of the heart can become chaotic. Instead of beating effectively, the heart may begin to quiver, a disorganized rhythm that prevents proper blood flow. And when that happens, circulation drops immediately. The precordial thump is a physical action, a controlled impact delivered to the chest that, in very specific circumstances, may help interrupt certain abnormal rhythms in their earliest phase. Think of it as a brief mechanical stimulus, not a replacement for medical care, not a guaranteed solution, but a potential intervention within a very narrow window of time. That window is short, typically within the first moments after symptoms begin, and timing is everything. Let me tell you about a patient in her late 60s. She woke up in the middle of the night with that familiar pressure in her chest. She called emergency services right away, but she knew help would take time to arrive, and she was alone. With the limited strength she had, she applied the technique. When paramedics arrived, she was still conscious and able to clearly describe what she was feeling. That made a difference. It helped accelerate the diagnosis and the treatment, and she survived without severe long-term damage. Now let's talk about how this technique is performed. Make a firm fist, then locate the center of your chest, right along the breastbone between the nipples. Use the lower part of your fist, the side near your little finger, not your knuckles. From a short height above the chest, deliver a controlled, firm strike downward, 1 strike per second. Repeat this 5 to 6 times. This is not about hitting hard out of panic, it's about precision, a focused, controlled movement, like tapping a specific point with intention. The reason this may have an effect is tied to the heart's electrical system. In very specific cases, that mechanical impact can momentarily influence abnormal electrical activity, sometimes helping restore a more organized rhythm in the earliest phase. But this only applies within a very narrow window of time, and it does not replace emergency care. Now there are important precautions. Do not strike too high toward the throat. Do not strike too low toward the abdomen. Stay centered on the breastbone, and do not exceed a few attempts, as excessive force can cause injury. If you have known bone fragility, such as osteoporosis, this is something you should discuss with your physician before considering. For many individuals, when applied correctly, it can be safe. But context always matters. Now we move to the third technique, and this is the one that surprises most people, not because it's complex, but because it comes from a place most don't associate with emergency cardiology. Before I show you, I want to point something out. Everything we've discussed so far is about reacting in critical moments, but prevention is just as important. There are steps you can take every day to reduce your risk long before an emergency happens. I've put together a detailed guide covering key strategies for protecting your heart on a daily basis. You'll find it in the pinned comment below. Take a moment to look at it after this video. It complements everything we're discussing here. Now, let's talk about the third technique. Technique number 3. This one surprises most people. It's called the Hegu point. When my uncle told me the full story of that day, he said this was the technique that helped him stay calm and conscious while waiting for the ambulance. He felt like he was fading. The dizziness was getting stronger. But by applying pressure to this point, he managed to stay present, long enough to hear the siren and call out for help. This technique comes from traditional Chinese medicine, specifically acupressure. But don't dismiss it because of its origin. In recent years, controlled studies in Western research settings have examined these pressure points using modern scientific methods, and the results have been increasingly consistent. The Hegu point, also known as large intestine 4, is located between your thumb and index finger. More precisely, it's the highest point of the muscle that forms when you bring those two fingers together. You can find it easily on your own, even in an emergency. Now, why does this matter? Because stimulation of this point has been associated with measurable physiological effects. Research has shown that applying pressure here may help reduce blood pressure, slow down an elevated heart rate, and improve blood flow to the brain during acute stress situations. In one study, participants showed a noticeable reduction in blood pressure within minutes of proper stimulation. And while that number may seem small, in an emergency it can be meaningful. Because when your heart is under stress, even a slight reduction in pressure can decrease the workload on your system. It can help you stay conscious, just a little longer. And sometimes, that's all you need. Now let me show you how to apply it correctly. Place both hands in front of you, palms facing down, one resting over the other. Using the thumb of your top hand, locate the soft area between the thumb and index finger of the hand below. You'll feel a small raised muscle in that region, almost like a gentle dome. That's your target. Apply firm pressure, slightly closer toward the index finger than the thumb. Press until you feel a strong sensation, pressure, mild discomfort, or even a slight numbness. That's normal. It means you found the correct point. Hold that pressure for about 5 seconds, then release for 2 seconds. Repeat this cycle continuously for 1 full minute on each hand. Now, this next part is critical. Your breathing. It's not optional, it's part of the technique. Breathe in slowly through your nose for 4 seconds, then exhale gently for 6 seconds. This breathing pattern alone helps activate your body's calming system, the one responsible for slowing things down during stress. When you combine controlled breathing with pressure on the Hegu point, the effect becomes stronger. You're not just applying pressure, you're signaling your body to stabilize, to reduce tension, to maintain control, even in a moment of fear. What's happening physiologically is this. When you apply pressure to that point, it generates a neurological signal that travels through your body to the autonomic nervous system, the system responsible for regulating heart rate, blood pressure, and overall stability. That signal can help slow the heart down, reduce vascular resistance, and improve circulation. The result? A heart working under less strain, a brain receiving more oxygen, and a mind that stays clearer, even while fear is trying to take over. Now, there are a few common mistakes people make with this technique. Pressing too hard, causing pain without increasing effectiveness, forgetting to breathe properly, stopping too early because it doesn't seem to be working. This technique needs at least 1 full minute per hand to produce a noticeable effect. Consistency matters. Now that you understand all 3 techniques, let's bring everything together into a simple emergency protocol you can actually follow under stress. Because in a real moment like this, you don't need complexity. You need clarity. Step 1. Call emergency services immediately, before anything else. If you can reach your phone, make the call. Professional help must be on the way as early as possible. Step 2. Apply forceful coughing. Take a deep breath, then cough strongly every couple of seconds. Continue for about 1 minute. If the pain is too intense and you cannot cough effectively, move to Step 3. Step 3. Precordial thump. Make a firm fist. Target the center of your chest. Deliver controlled, downward strikes 5 to 6 times. Step 4. Stimulate the Hegu point. Apply firm pressure between the thumb and index finger. Hold for 5 seconds. Release for 2. Repeat for 1 full minute on each hand. And remember to breathe slowly and deeply throughout. If at any point you feel like you might faint, lie down immediately. The floor is the safest place. A fall could make the situation much worse. Now, one more critical point. Try to stay as calm as possible. I know that's not easy. But panic increases your heart's demand for oxygen, and that's exactly what you want to avoid. Every slow breath helps your heart. There's something else I need you to understand. This may be the most important part of everything we've discussed. Studies have shown that people who practice these techniques beforehand are significantly more likely to perform them correctly during a real emergency. Because under extreme stress, your brain doesn't rely on what you've just learned. It relies on what you've practiced. Your body remembers what it has done before, not what it has only seen once. So here's what I want you to do. Don't just watch this and move on. That won't help you. What helps is practice. Tonight, before you go to sleep, sit somewhere quiet. Practice the technique. Do 10 slow, controlled repetitions of forceful coughing. Locate the center of your chest with your fist. Feel exactly where it is. Find the Hegu point between your fingers and apply pressure for a few seconds, just to recognize it on your own body. Then take a piece of paper. Write these 3 steps clearly. Put it somewhere visible, on your refrigerator, in your bathroom, and share this video with someone close to you. Because in an emergency, knowing that someone you love also knows what to do can make all the difference. Now, before we finish, I want to give you 5 daily habits that protect your heart, not just in emergencies, but every single day, because prevention is always more powerful than reaction. First, walk for 20 minutes a day. You can split it into 2 sessions if needed. Simple movement like this has been associated with a significant reduction in cardiovascular risk. It doesn't need to be intense. It just needs to be consistent. Second, practice deep breathing for 2 minutes when you wake up. Inhale slowly. Hold briefly. Then exhale longer than you inhale. Repeat this pattern several times. This helps regulate your nervous system and can support healthy blood pressure levels. Third, include fatty fish in your diet at least twice a week. Options like tuna, sardines, and salmon provide omega-3 fatty acids that support vascular health and reduce inflammation. Fourth, be mindful of smoking and excessive sodium intake. Both place additional stress on your cardiovascular system over time. And fifth, monitor your blood pressure regularly at home. A simple device can give you valuable information early, before symptoms ever appear. Because here's the truth. Most heart attacks don't happen suddenly. They are the result of years of unnoticed patterns. Elevated pressure, ignored warning signs, habits that didn't feel harmful until they were. Your heart adapts, it compensates, it keeps going until one day it can't. But there's something else I've learned over the years. It's never too late to change direction. Never. If you have a family history of heart disease, if you live with high blood pressure, diabetes, or excess weight, your risk may be higher. But so is your ability to act, starting today. This is not a reason to panic. It's a reason to act, with awareness. Schedule a medical appointment. Run the appropriate tests. Have an honest conversation with your doctor about what applies specifically to your situation. Because preventing a heart attack is far easier than surviving one. And surviving one, without lasting damage, is far more likely when you know what to do in those first critical moments. Today, my uncle is in his 70s. He spends time with friends, enjoys his family, and lives a normal life. And every now and then, he brings up that afternoon. Not with fear, but with a quiet sense of gratitude. Gratitude for knowing what to do, at the right time. He once told me something I've never forgotten. Knowing what to do when the heart fails is one of the most valuable things you can give someone. And I agree. That's why I made this video. If you learned something today, share it with someone you care about. A parent, a friend who lives alone, a neighbor. You don't need to explain anything. Just send it. Because you never know who might need this information. And when. If this kind of content is valuable to you, subscribe to the channel. Turn on notifications so you don't miss what's coming next. In the next video, I'll show you 5 silent warning signs your body can give weeks before a stroke. Signals most people completely overlook because they seem harmless. Stay alert for that. And remember, this video is for educational purposes only and does not replace professional medical consultation. If you have heart conditions, bone fragility, or any concerns about the techniques discussed, speak with your physician before applying them.